So welcome everyone to our first part of our writing and submitting your NNLM proposal for Region 1 grants. Part 1 is basically related to getting ready and getting organized with everything you need to do to work on your application itself. I am joined today with Nancy Patterson, who is our outreach librarian, who also helps me with a lot of the administrative tasks related to making sure that your award is successfully completed by the proposed end date. As an FYI, we are sharing a number of different websites. And one thing that I'd like to do in advance is to at least share with you a link to the resources that we intend to reference in this part of the presentation. So we have a basic agenda for today's session. We'll cover some lingo, knowing the NNLM a little bit, understanding yourself or your organization, knowing the community that you intend to do some outreach with. We'll share what our grants applications are going to look like for our Year 3 program starting May 1, 2023 to April 30th, 2024. And we'll share a few resources on deconstructing a request for applications, request for proposal. It might also be referred to as a call for applications or call for proposals. And then we'll have some time, hopefully, for some Q&A. Nancy?
Yes, hello, everyone. Thanks for joining us today and for your interest in our funding. We love working with all of our fundees, so hope we can bring something together for you. So one of the stumbling blocks I hear from people about funding of any kind, including ours, is the lingo problem. You know, what do all of these words mean? There's a lot of acronyms that are used, a lot of things that are words that you understand, like statement of need, but what does that really mean? So I thought I would ask, before we get to sort of the usual things we hear, thought I would ask, are there any words, terms that you need clarification for, that you're aware of at the beginning here? And feel free to unmute or just use the chat, because we're happy to address specific questions. That's one thing we want to make clear is, you know, this is informal, this is to help you. And Tony and I are also available for individual consulting to get more specific into any funding questions you might have too.
Okay.
RML.
Jaren
Yes.
asked the RML.
Yes, so Jaren, thank you. That's one of the many in the world of acronyms with NIH, NLM, NNLM, RML, ROC. So I think we'll go to the next slide because that's one of the ones we're thinking of. Your pick, Jaren, is one of the usual suspects. So the RML is the Regional Medical Library. And we're going to get to knowing your funder in a moment, where I can show you a nice map about how NNLM works. But for Region 1, the University of Maryland's Health Sciences and Human Services Library, where Tony and I work, is the Regional Medical Library for 9 states. And Tony, I bet you can rattle them off. I'm going to say Delaware.
I'm not going to rattle them off because then I'll feel embarrassed if I.
Oh, I think I can do it. District of Columbia, Delaware, Kentucky, Maryland, North Carolina, New Jersey, Pennsylvania, Virginia, West Virginia. I'm forgetting someone.
Kentucky.
I got Kentucky, I think. There's 9 of them, but it's basically this area, this region, and I will share a link with you in a bit where you can see the exact info. But that's RML, is the Regional Medical Library. And we're equipped, you're welcome. And we're equipped as regional medical libraries to help those states in our region with various things, not only the funding, but also resources and sharing information, helping with research questions and things like that. Are there any other from anyone else? While I'm waiting for that, I'll move on to a few other things. You will see with funding announcements that there's an RFA, an RFP, a CFA, a CFP, and these are call for applications, call for proposals, request for applications, request for proposals. That's what that means. And there can be differences depending on the funding organization, but basically it just means there is funding available and this is the announcement. So in that announcement will be all of the information you need about the eligibility, the requirements, etc. So those are very, very important terms, and those are the things that blip on your radar when you want to do something fabulous in your communities. The RML we already addressed. The ROC is another NIH, NLM, NNLM. And this is National Institutes of Health, National Library of Medicine, National Network of
Network
Network
of the National
Library of Medicine.
Yes.
And the ROCs are the regional offices and centers. Did I say that right, Tony?
ROC refers to the regional medical libraries, all of the offices, and all of the centers. And
yes,
there's a later slide that we'll share that lists all of the different offices and centers. And those are scattered throughout the US as well.
Yep. And we've got a ton of resources in various places for you too, related to that. So grant or award, if you've been paying attention to NNLM for a while, you know, we used to call them awards and now we call them grants. It's the same thing. It's only different for the red tape on our end. It's the same thing. We have funding for you. The sub-award is lingo we use because we are awarded a contract every 5 years. And I will explain more about this when we talk about knowing the funder. But as the regional medical library, we are awarded by contract. So we are funded, and then we are funded with an award, and then we provide sub-awards to those who apply for our funding. So letter of support, this is one, if I can etch in your mind, whenever you do any kind of application for funding, provide letters of support. They're not always required, but boy, do they boost your chances because they really show that you're engaged with partners. And that's a partner vouching for you, basically, that they write a letter to the funding organization and say, we work with so-and-so, they do great work, we want to do this and that with them, you know, and it really bodes well for the success of a project. So it counts for a lot. Activity in our world means any of those outreach events that you conduct. So if you're going to teach a class, that's an activity. If you're going to have a health fair, that's an activity. If you're going to do a series of classes, those are activities, you know, and the activities are one of the reports that you have to do for NNLM. So we'll talk more about reporting in a later webinar, but you do report for us when you do an activity. Tell us where it was, how many people attended, and what you did. A little more information we asked for, but basically that. And then we can really measure the success of our subaward projects. FNA and IRB is...
You want me to answer?
I'm going to let Tony, I can, but you do it better.
Okay, so FNA refers to facilities and administration. So if you work at an academic institution, even some hospitals, especially the research hospitals, you have a grants department. They might be referred to as sponsored programs, administration, sponsored programs office. Get to know them early on. But facilities and administration, these are negotiated rates that your institution has with the federal government. So if you have a project worth that you have, it costs you maybe $20,000. Your sponsored programs office says, okay, those costs, and it could be maybe the cost for time and effort, it could be materials that you want to purchase, it could be for technology or equipment that you would like to use, it could include travel. Those are considered your direct costs. The indirect costs are things that aren't necessarily calculated, and that includes the facilities that you're using. So where you work, it could include electricity, all the utilities that may be involved, the maintenance of where you work, those things. And it could also include things like the procurement office, your budgeting people, the people who cut out your checks and everything, for instance. So that's the administrative side. So the facilities and administration is a percentage of your total bill that's added on to your proposal. So you have to look and see when you're looking at a request for applications, is the amount inclusive or can you add on top of? So a lot of times people refer to F&A as indirect costs. So you have your direct costs where you outline it in your budget, and then at the bottom is your facilities and administration or indirect costs. So check with your sponsored programs office to see what is that percentage amount for your project. And if you have any questions, you can ask us more about that if you'd like. IRB refers to Institutional Review Board, and it sounds a little odd because a lot of our projects are outreach projects or they're training classes or something along those lines that we fund. With new guidance from NIH, any project that we fund has to go through IRB and receive a determination from our Human Subjects Rights Protections Office that it is not considered human subjects research, or if it is considered human subjects research, what is its status? And that could be an exempt status as well, and it'll have a certain number tied to it. You are allowed to do human subjects research, and if you're an academic institution that has that, you would want to include that determination letter with your proposal, and we'll go through a process behind the scenes with your IRB department and our Human Subjects Research Protections Office to get concurrence. So human subject studies are allowed with our program. There's some processes that we have to do. And this is also why we are announcing our project awards so much earlier than we have in the past, because it does take some time for our IRB department to review the applications that we'd like to fund. So to be more fair so that you have more time to complete your projects, we're starting the announcement much, much earlier. Does that answer those two? Hopefully. Okay. So there is a resource that we want to share with you. It is our NNLM Proposal Writing Toolkit. And I have it available here. And what it does is gives you some guidance of like, you can look at some of our past funded projects. So if you're looking for certain ideas and how you'd like to start the project, you can do that. You can look at what are our initiatives, priority areas, look at our classes that we have available, because you can adapt those classes and utilize them for yourself and for your user base as well. We also provide a number of different proposal writing tips and tutorials. So we encourage you to get some background information so that you can help with writing a good proposal. And if you want, you can look at some of the templates that are available, utilize a number of different resources, and that can help you out as you're working out your proposal. We also provide budgeting guidance. And just like with the federal government, there are some allowable costs and there are things that you cannot put into your budget. And if we see that in the budget, we strike it out. So thoughtfully consider your budget and think, is this allowed or is this not allowed? And you can go through this link here and it'll provide you some more details as to what is allowed and not allowed. We also provide you some information on creating a budget, and we provide for you also a budget template that you can use. And then we give you some guidance as to creating a budget justification, if that's something that you'd like to do. It's one thing to say travel, I need $5,000, but outlining the details of that travel gives us more insight as to how you're thinking and how you came up with the cost totals. So that's incredibly important as you're working that out. We also provide you some guidance on evaluation, and there are a number of resources from the NNLM Evaluation Center that can really help you in developing your evaluation. There is some guidance on submitting your application, but you can always ask Nancy or I if you have any questions about submitting your application. And that's why I think it's always important to maybe start working with a template. So I encourage you to look at that and think about utilizing a template first, and then work on the submission process later. Also, we also want to make sure that you're aware of the review and selection of proposals. So here's the basic criteria that we like to follow, and we provide you some exemplary samples that you can utilize, some scoring guidance. So if you can, we're being transparent as to what our peer reviewers use, and we want to make sure that that's utilized. And then in case you realize that, we're not providing the right kind of award for you, we want to at least share some resources that would be beneficial for you, and maybe finding other sources for funding. So this again is a resource that I think would really benefit you in the long run. Nancy?
Yes, so thank you, Tony. So yes, please use the proposal writing toolkit. I think you'll find an awful lot there, but as Tony said, we are here for individual consultation anytime you need it. So you'll see the next three sections are knowing your funder, knowing yourself, knowing your community. Sometimes yourself and your community are the same thing. Sometimes they're not. So you can't overemphasize how important this is to do this kind of research, to know if you're a good fit, to know if your idea is going to mesh with NNLM's vision and mission. So with our mission that you can see here, I won't read it to you. Any idea you have that is improving health or health processes or health information sharing, falls into this, where we're working on the health professional end all the way through to the general public, talking about health information and access to information. So, there's a lot of things you can do. One of the great things about the projects that we fund and reviewing them is, my gosh, we get so many different ideas. So don't feel like you have to do, something that's done all the time. Don't be afraid to think big and be creative. So knowing the mission of the NNLM, does it mesh with yours, your organization, or with what you're trying to accomplish? And if you are doing something with health information, I think it would be pretty hard not to mesh with us. So depending on the exact information. In terms of relationships, I mentioned earlier about NIH, NLM, NNLM, but basically the National Library of Medicine is one of the National Institutes of Health. I think, are there 30 something of those, Tony? I always forget the number.
I forget how many. I think it's around.
It's somewhere around 30. So there are all these different National Institutes of Health. And by the way, those can be fantastic resources for ideas. If you go to the institutes and look at their focus or what they're working on or resources they have, that can really flesh out a project sometimes. But it is one of the National Institutes of Health. And then the National Network of Library of Medicine is the outreach arm of the National Library of Medicine. The National Library of Medicine is an actual brick and mortar library, largest biomedical library in the United States and possibly the world, I think. That sounds right. We're comfortable with the United States for sure. But it's on the 22-acre campus of the down in Bethesda, Maryland. And it's something to see if you can ever take a tour down there. It really is a cool experience.
Right now, you can not take a tour because it's still under construction. They're doing a huge remodel. So
okay, but when you can, it's really cool. And anyway, so NNLM we're an outreach arm of the National Library of Medicine. So that's the relationships there. The RML, as we talked about, the Regional Medical Library. The Regional Medical Library for Region 1 is the University of Maryland, Baltimore's Health Science and Human Services Library, where Tony and I both work. So those are some relationships, because it can get confusing as we're throwing around these acronyms. Next, please. And this is what I was alluding to earlier. You can see the different RMLs numbered 1 through 7. and where they are in the states that they cover. And we, if it makes you feel any better as you're applying for funding, we have to apply for funding every 5 years for our contract. So every 5 years, these regional medical libraries are selected. Many have been going in the same institution at the same health sciences library for many, many years. But there are always chances of new ones. So those are the 7 regional medical libraries, the 7 regions of the NNLM. And we do have offices and centers as well. Under the offices, the Office of Engagement and Training is the department at the National Library of Medicine that really manages NNLM. They manage a lot of other things too, but one of their projects is to manage NNLM. They aren't so much for public information, but the next 2 are. So Public Health Coordination Office and the Training Office. Both of those will be very nice resources for you. And by the way, I meant to share this link while I'm talking here. Because if you go to, let me just pop it in here. You can see, this is in the link handout as well, but you'll be able to see things and go to the websites for the Public Health Coordinating Office and the Training Office. They've got resources, both of them, that you might use in a project or that you might use for research. So the Web Services Office really isn't useful to other people, but they are extremely useful to us because they make everything happen for us that happens online. So, which is everything, but there are technical support. In terms of the centers, how many people here are familiar with All of Us, the initiative from NIH? I'm going to share a little link about that too, and encourage you to learn more about it.
Jaren is familiar with it.
Sorry?
Jaren is familiar with it.
Oh, good. Oh, great. So the All of Us initiative, it's an NIH initiative that has a lot more to it than what we have time to cover today, but the goal is to get 1 million participants. And what are we at, about 500,000 now, Tony?
We're about 500,000.
I think so. Yes, so thank you, Jaren. Yeah, All of Us is doing amazing things, but their goal is to get 1 million participants to sort of even the playing field in terms of research information that we have about the populations in the United States. So it's a lofty goal. It's a big project. Recommend reading more about it. But we do have 2 centers, 2 centers focused on All of Us. The Community Engagement Center, which does exactly what it sounds like, and the Training and Education Center, which provides oh, Marissa, great. Yes. So you received an award from All of Us. Fantastic. Yes, they have funding too. So that's another resource for you. But the Training and Education Center has their materials for teaching and training. The Community Engagement Center are the people who are actually going out and making connections in communities. So really recommend learning more about All of Us. The Center for Data Services is new-ish and also is self-explanatory, but there's some good information there on that site. If you are into data management, the big and small pictures there. And the Evaluation Center is something that I really do recommend taking a look at if you're applying for our funding, because evaluation is critical to writing a good proposal, and building it in from the beginning makes everything so much easier. But they've got a lot of great resources, from how to do a community assessment, to how to create partnerships, to how to measure your success. So all of these things fall into the region's offices and centers, the ROC of NNLM, to throw out some acronyms. Next, please.
And this is me. So the NNLM has some particular areas of focus over the next few years still. The first one is related to confronting health misinformation. So it actually emerged from the US Surgeon General's advisory on building a health information environment. And it stated that misinformation thrives in the absence of easily accessible, credible information. When people look for information online and see limited or contradictory search results, they may be left confused or misinformed. More broadly, misinformation tends to flourish in environments of significant societal division, animosity, and distrust. So what we're looking at is trying to raise awareness of trusted, high quality, and relevant information and develop strategies to improve health literacy, data literacy, and understand and actively engage in medical research. And when I say that, I refer to clinical trials too. Bridging the digital divide, I think when the pandemic first hit, it highlighted a number of different barriers to health and well-being that were increased due to the digital divide. And so we're looking at different projects that can help address the digital divide and decrease internet connectivity, the lack of Wi-Fi, video chat, webcam technology. And this is seen both in urban and in rural areas, actually. And then there's environmental determinants of health, which is a very vast area to think about because it's factors that are related to human health, physical, chemical, biological factors that are external to a person, and all of the related behaviors. So there's a lot of different things that could be tied to this. Topically, it could be socioeconomic factors, natural and built environmental factors, pollution, climate change, disaster information management, mental and emotional health, rural and urban health, tribal health, access to healthcare, health advocacy, and sustainability as well. Conversely, we also want to support different priority areas that emerge from both NLM, the National Library of Medicine, as well as the National Institutes of Health. And so here you'll see some of the four that are major foci from NIH and NLM. Community science is more referred to versus citizen science these days because citizen can be othering for many individuals. So we want to be able to engage with communities to address societal needs and accelerate biomedical science, tech, and innovation. Data science, it's outlined in great detail in the National Library of Medicine strategic plan. So if you're not familiar with the NLM strategic plan, I'd be more than happy to share with you that document if you'd like. And then student engagement, this is slightly more tied to building people up to be actively engaged in both health sciences librarianship, but also to engage people to become data scientists themselves. So we've seen projects where people are recruiting internships and paying them equitably so that they can get some live experience to serve as a librarian or do data related projects, any number of different things. And if you're interested in maybe talking more about student engagement activities, you can certainly give us, we can certainly hold a consultation to see if the project would be of interest as well. And then there's still substance use disorder. It's related to opioid overdoses, among other things like alcohol misuse as well. So those are some of those different things that would be related. And Samuel's interested in the data science topic. So let's see if I can share with you the document from NLM. It's bizarre, Nancy, how I had that available.
I know.
But you can go there to learn more about data science and how NLM is looking at data-driven research as their initiative as well. So let me move forward from there.
Okay, so hopefully you feel that you know a bit more about the funder, and I encourage you, get to know us better. Again, can't emphasize enough, we're happy to meet with you individually, happy to flesh out any information or answer any questions you have. We know this is necessarily a brief overview. But the next step is knowing yourself. Knowing yourself can mean, that's okay, Tony, you can go ahead.
Oh, okay.
Knowing yourself means two things, knowing your organization and also knowing your community. You may be part of both. Oftentimes your organization isn't exactly part of the community, but you have a community where your outreach is going to happen, or where you have the partners that are part of the community. But knowing your organization, really, and the evaluation center that I mentioned, and some of our other resources on the proposal toolkit will help you with this in terms of looking at your assets, looking where you're lacking expertise or lacking resources, thinking in the way of where can you get complementary partnerships and where can you fill in the parts that you don't have. So, what is the expertise of your staff, or what is the availability of your staff? A lot of places are contending with low numbers of staff right now, or a lot of openings. So what is the real availability that they have, the time or the expertise, that is with your staff, with your partners? Who are they? What are their strengths? Where do they need help? What are they bringing to the equation that helps you? What equipment are you going to use between your organization or between, from partners? Space where you might do your outreach, resources that you plan to share. Looking at your mission, vision, priorities, and initiatives, and not all organizations have all of those, I know, but even a community sometimes has kind of a motto. So I'm saying, think broadly about what either the organization or the community is representing and what they want, and how does it intersect with NNLM's vision, mission, initiatives, priorities, all of that. Usually you could find some intersection, and if it would help to talk with us, we can help you find some, I bet. Next, please. So the community is a tricky one, in the sense that when I say know your community, I definitely don't mean assume you know your community, okay? So knowing your community, I say it's tricky because you do need, when you apply for funding, to have done your research. You do need to provide some statistics. You do need to justify need. We've got a lot of resources here on this slide. All are linked in the toolkit that we mentioned, except for the local departments of health. You're on your own for those, but they're pretty easy to find. So there are lots of great tools for getting those statistics and determining, that level of need in a community, but it's the community itself that will tell you what they need. So for example, if you have a passion for improving maternal health outcomes in a community, and you go, racing in there and saying, we're going to fix your maternal health problems here. Sure, they may have that issue, but they may have something much more pressing. They may have their hands full with some other, it's the National Evaluation Center, Lisa, and it's part of NNLM on one of the links I shared above. Yeah, there you go. But I lost my train of thought. I'm sorry. Back up. Okay, so they may have their hands full with something else. While it might be true that they have some statistics that indicate maternal health problems, or they could have better outcomes, they may have their hands full with substance misuse problems. They may actually be, really, really bent on improving broadband access in the state, and that's where all their energy is going right now. In the case of the latter example, you could then maybe do a win-win in saying, well, we'd like to work on maternal health. That's where our expertise is, or where our partner, has strength. But we could accomplish that by also banding with you for this broadband initiative, and see if you can build in that partnership. So that's my big takeaway from community is, please don't assume you know the community. Make sure that you have trusted partners that are embedded in the community and really, really have their finger on the pulse. On the flip side, you do have to have statistics. You do have to back up justification of need. So just be aware of that two-pronged approach there. And the other thing to know with communities is what has been done before. What has worked, what has not worked. What has not worked is sometimes so much more valuable to know about than the successful ones, because you learn so much. So what was attempted and failed, and why did it fail? What could you maybe do differently, or what needs to be avoided entirely for reasons, that a previous project found out. But looking at all of that is super important, and learning about what's been done before. Also looking at who's doing the work in the community. If you're fresh at the total beginning and you don't even know what partners you want, sometimes the people doing non-health related stuff in the community are the ones to enlist and help with your health information outreach. A lot of times it's the same people in the community who are active and out there trying to help across different topics. So those are just some things to know about the community and to find out from the community. Next, please. Yeah, so as you're thinking about yourself, your organization, and the community, these questions are relevant in so many ways. Who are you trying to reach? How do you need to reach them? Or what is the best way to reach them? If you have a population that doesn't have broadband access, for example, and you're thinking about an online project, you need to rethink that. What is it you exactly are going to try to do? What form will your outreach take? Are we talking health fairs? Are we talking classes? Are we talking, we've had some organizations do skits, acting out scenarios, and then providing solutions using Medline Plus. Why are you doing this? This ties into the justification of need. So that two-pronged, what does the community declare they need, and how do you justify it with statistics? Where are you going to go? If you're expecting people in an area that doesn't have good transportation options, where people don't have cars, and you're expecting people to come 20 miles, that's not going to work. So how are you going to reach them? Where is a good place to do this? What place has the technology that you need if you're using technology? Just thinking about all the logistics. And when is the time to do this? What time of year? What time of day? Is a weekday better? Is a weekend better? Should you offer different time slots so that more people can join that might have conflicts on an ongoing basis at a certain time? With this who, what, when, where, why, we can go on and on and on, but it's just important to examine all of these aspects as you're building your project idea. Next.
Oh, okay. So I guess I need to inform everyone about the 2023-2024 grants. Now, the good news is that we've made the grants a little bit larger than it has been in the past. The bad news is there are fewer awards that we're giving. And the reason is because of the sheer amount of paperwork involved with human subjects research, and the capacity for us to complete all of the tasks so that you can actually do the work that you need to do. So the biggest tip that I want to share in advance is the stronger your proposal, the higher your chances are. And we'll talk about evaluation or what the peer reviewers do when they're looking at your application down the road. So that'll happen at a later session. But so just again, start thinking about writing the strongest application possible. So here are the applications that we're looking for. We will be funding 5 $30,000 project awards. One will be related to data science and services. One will be related to technology improvement. And then we hope to offer 3 projects related to health information outreach. It does sound competitive, but I think, we'll work with everyone so that it makes it harder for us to decide who it is that will get funded. I am actually one of the more unbiased people because I don't really look at your applications until the very, very end, and I look at how they all ranked. And that's what I follow when I start looking at all of that and make the decisions at the end. But I try to be helpful and unbiased and not make things a little more awkward than they should be as the funder. But this is the process and timeline that I wanted to share with everyone. So we made the announcement of applications being open. It goes until November 4th. Basically, November 4th, I think 4 p.m. perhaps, or 5 p.m. I think. It's basically right before our office closes that Friday. So we hope then leading up to that period, we'll have enough significant applications and we can make some award decisions. From there, the Region 1 staff has to look over all of the applications received to make sure that they're complete and they are eligible for funding. So if someone is outside of our region who applies, we probably will not fund that project and inform them that they are not eligible for this project award. After we've looked over everything, made sure that the applications are complete, we then try to identify our peer reviewers to review the proposals received. Generally, the peer reviewers that we select are not even in the same state where the person who is submitting it are. So they have zero idea what your community is. They don't know anything about what you do, your community, or anything. So think about it like that. They might not even be in the same field that you're in. So also think of that. If you're someone that uses a lot of acronyms like we do, as you've seen earlier in this presentation, avoid them, or at least explain what that acronym is. So again, you want to try and write it in a way that someone off the street can look at this and understand what it is at the heart of everything you want to do. And you've explained it as eloquently as possible so that they can say, yes, I understand exactly what they're doing. I understand the community that they're sharing. I understand everything and how they intend to evaluate the success of this project. So just as a heads up regarding the peer reviewers. In January, what we hope to do is notify all of our applicants of our funding decisions. And then I also will provide feedback for all of the applicants as to if they were not selected, why they were not selected. And I try hard to find the areas for improvement based on the peer reviewers' comments as well. In January, for those that are selected, we'll ask you to complete some required documents that our sponsored programs office requires. And then following that, we will begin work on the peer review, not the peer review, but the IRB process with our Human Subjects Rights Protections Office, and make sure that we work on getting all of the administrative paperwork processed by May 1st. And hopefully, theoretically, fingers crossed, you'll be able to start the project May 1st. And then you should be able to work on submitting activity reports. Nancy will talk about all of these different reports that are required of you, but you should be able to then complete your project by April 30th. And then by the end of May, we hope to have your final invoice and a final report submitted to us. And then all of the accounting records are closed after June 30th. So that's our general administrative timeline regarding your projects. Let's move next to this. Nancy?
Yes, okay, so deconstructing the RFP is just a fancy way of saying breaking down the request for proposal. And next slide, please, Tony. We just needed to be dramatic with the wrecking ball there. Did it get everybody excited?
Very Miley Cyrus of you.
But breaking down the actual request for proposals, the call for applications, whatever it's called, the funding announcement, really parsing it out and breaking it down is, I think it's not only critical to making to writing a good proposal, it's, I think, critical for keeping sane while you do it. Because if you don't do it, if you don't break it down into the nitty gritty and kind of get the lay of the land, you're apt to go off in the wrong direction and put an awful lot of your energy and any of your partner's energies to waste, because you'll have to regroup if you've got some things wrong. In a simple sense, I find with call for or requests for proposals or whatever the funding announcement is, I find it really helpful to go through and pick out some keywords. You know, you'll notice with any kind of funding announcement that there's words that appear over and over and over again. And those are worth noting, because if you can build them in to your proposal, that helps blip on the radar in a way that speaks the language of the funding organization. Examining the funding timeline, the deadlines, actually, the first question should be, are you eligible? Looking at the missions and the other things that we talked about in terms of overlapping interests between the funding organization and your organization or your community. Formats, templates, all of that is hugely important. The contact person, very, very important and great to note, because it's very helpful to blip on the funding organization's radar early. I'm interested in this funding. Can you tell me more about this? Make personal contact. The people are there for that. We are here for that. And I don't want to take too much more time on this because I want to have time for questions. So next slide, please, Tony. There's a lot more here on how to do it and how to just sort of break it down, figure out the format, figure out the best way to do it, the deadlines and all of that stuff, and how to organize your, well, whether it's yourself or whether you've got partners doing it, but how to organize yourselves to really, get it laid out in a helpful way so that your energy is being used most efficiently. Next slide, please. And now Tony.
Great, budgets. So I mentioned a little bit about budgets when we talked about facilities and administration costs. So if you are in an academic institution, I strongly encourage you to talk to your sponsored programs office. And I did mention that the close date for applications is November 4th, and they might say, our office needs to review your application before it's submitted. I need you to submit that, say, a week or two prior to the deadline so that they themselves can submit it after reviewing it and asking you for any questions. They're really helpful, ours is, because they say, oh, we need this document, or you're missing this document, it's not complete based on the requirements, or this document cannot have URLs that are linking. It has to be non-linked text, for instance. So it just depends on the funding agency, but they really look at the requirements and can help you walk through everything. They also look to see, are the costs that you're listing in your budget allowable or not? Did you budget properly what the direct costs were from what you are asking for, and include the indirect costs, which was the facilities and administration? They want to also make sure, did you properly justify your budget with a narrative properly? So, and then a lot of times people don't think about, you may have heard what your salary is, but there's a percentage amount related to fringe. So you may have to include that as well. So there's a number of different things that you have to include and think about, and this can help you as you're developing and formulating what your budget may be. And it could be something like simply, are you justifying your honorariums appropriately? And do they look like what is the national standard for honoraria based on your project? So that's another thing that they might be looking at as well. So I mentioned this multiple times. Again, I made sure to include it for you here, because if I don't, I tend to forget. But again, be very close friends with your Office of Sponsored Programs. It will save you and us hours and hours of work. So please be good friends with them to make sure you have everything that they need, so that there's no weird back and forth that occurs, and you might end up missing the deadline too, because I have seen that happen with some applicants in the past. So again, talk to them about the processes they have, the requirements that they have, change of deadlines, because if we put in November 4th and they say, no, we need it by October 15th, actually, that changes how fast you can write your proposal. And then confirming the facilities and administration rates. Now, for some academic institutions, facilities and administration rates can be really high. It could be anywhere from like 30% to 55%. I've seen some that were at 60% from the base rate even. So you should talk to your sponsored programs office, because that 60% rate is related to human subject studies and clinical trials and research like that. Most of the projects I think a lot of people are doing are under a different category entirely. And actually, the federal government has it listed as other. So you really need to confirm with them, can I use this rate? You might also check with your dean to say, can I get the F&A rate waived? There have been many institutions who have worked with their university dean to say, can we get this F&A rate waived so there's more money for us to spend related to the direct project itself? Nancy.
Okay, and the last little bit is about brownie points. To be clear, brownie points will not save you if you haven't done the basics. But if you have done the basics, there are things that really stick out for us. One is you make yourself known. You know, it isn't that the reviewers know that we know you, but your proposals will get better and better through the years if we're working closely with you and we know what's going on with your concerns about the community and all of that. So that really helps get your proposals shaped up over time. Follow instructions, deadlines met. No tables or pictures. That's a funny one that a lot of people don't, they kind of miss that detail, but the technology we have will not support it and it complicates things badly. So no tables or pictures, follow those instructions. Clear and concise is always tricky because it's, you know, you have to provide enough information, but you don't want to overload, right? And that's a hard balance to strike. But if you can strike it, that really comes off. The reviewers are reviewing a lot of different applications, and it really sticks out when somebody can be concise, get their point across clearly, but in a concise manner. Spelling out acronyms and avoiding lingo is important. The budget adding up is obviously critical, and also that it matches the narrative. You know, there's a narrative portion, which Tony showed you earlier. It really needs to absolutely match up with the spreadsheet. And letters of support is the biggie of brownie points. It bodes well for you. It vouches for you. It lets us know you're connected already in the community and thought well of. So those are huge. And those are just some brownie points to keep in mind.
And can I add to the letters of support, Nancy?
Yeah.
When I think about letters of support, there are two types of letters I usually see. One is a letter that says, we support this project. That's it, right? There's another letter that says, we really wholeheartedly accept this project. We hope to have event space available to support the classes that they're offering. We'll provide some of our staff time available to help with this project as well. It's outlining how they are specifically supporting the project itself. So when you see letter of support, it's not basically a letter of reference. It's a letter of how they plan to support the project itself. And, you know, if you're library staff, maybe it could be from even your manager that says, we support this project idea. We hope to utilize additional staff time beyond what's outlined in the proposal so that they can complete the project as well. So definitely think about that when we say letters of support, because a lot of people will write a basic letter and it doesn't give us those brownie points that we're looking for. So definitely keep that in mind.
No, great points. And so, Jaron, I love your comment that we're saving you dozens of hours of work over the next few years. We do have more webinars coming, and we're going to be quiet momentarily so that we can take questions. Next slide, please, Tony. So the next webinar, this is, you know, 4 webinars in a row, same time slot on Tuesdays for the next 3 Tuesdays. We're going to continue. And the next one, we're going to talk a little more in depth about the grant opportunities we have. A little more detail about the funding process and timeline, some of the nitty gritty of writing, and some examples of strong proposals, and time for questions. And speaking of questions, what questions can we answer for you? And one little comment to say, this is very necessarily brief. So please know we're available to expound on things.
And as a reminder, I'm putting a link to the resources that we reference. So if you wanted all of the links, you can go to that. And also it has our email addresses as well as our scheduler. You'll see the calendly.com link. You can schedule a one-on-one with Nancy or I, and we can talk about your proposal ideas further for you if you'd like. Jaron, you have a question for us.
I do. And the biggest question is actually, is it all right to keep asking questions? Because as you showed the map, I realized that I am not in this region. I'm in South Carolina.
Okay.
Okay. You're in region 2.
Yes, I don't know how I got this I've never seen anything from Region 2. And so not to say that y'all are doing any better or worse, but this is really informative. And I was just wondering, so I've actually signed up for some of the coming, because it's a 4-part series, right? I've signed up for the
Right.
next 3. Is it
Yes.
okay if I hop on?
Of course.
Of course.
A lot of this could actually apply towards Region 2's project awards. And it could actually, I mean, a lot of the stuff that we've mentioned earlier are helpful hints that helps with maybe IMLS grants, NIH other grants, or, you know, if you apply for the National Science Foundation grants, you know, a lot of them are basic enough that they can be applicable to other granting agencies, foundation grants, and things within your own institution, like with our foundation, they offer grants as well. So we can apply for grants. And so these are just general helpful hints that can be applied anywhere.
Perfect. That my main question was, can I keep asking questions? Because I think I'm in
Yes.
the wrong place, but no, I
No,
really appreciate it.
you are
course.
free to ask us questions.
Oh, it
And
looks
if
like I'm
it's-
not the only one too. That's
Yeah, and it can be, and if we want to confer with Region 2, we'd be happy to confer with Region 2. I think we
Yeah.
can have you touch base with Isaac or Lauren if there are specific questions, but I don't think they have announced their projects yet as well. And I think the same thing with Region 4, they haven't made an announcement yet, Lisa. But Lisa, I think for Region 4, they actually hope to make an announcement like the first week of October for their project awards for year 3. So,
Yes.
you know, keep that in mind for them. You'll start seeing other regions make an announcement. We're a little early, but we have a realistic time frame of when we hope to get everything completed too. And we know how slow some areas may be. Do the funds cover personnel costs for staff and maybe student support? Yes. You can put in time for costs for staff, faculty, student support, whether it's a GA, an intern that you'd like to hire, or honoraria as well. Those are things that you can put into the budget. I think that answers your question, Michelle. Other questions?
We did get a question, perhaps everybody saw, but we will be emailing you within a week or two with a link to the recording of this webinar. All 4 webinars will be recorded and they'll be available. And Samuel, you have a hand raised?
Yeah, right. First, can you hear me clearly?
Yes.
Okay. Just came in my mind is that if this project, if this project will be with some other organizations, should this organization be added into the application as the I don't know. I don't remember what that field name, but should this other organization should be added into the application as participating organization or something like that?
Yes, they can be added as a partner or a collaborator, however you'd like to utilize the word. And they can be added for like staff time as well. It's unfair for some institutions to collect just the money, but if they themselves are contributing a certain percentage of their time, perhaps it would be beneficial to include costs for that staff, and it would be up to your institution to make sure that they get paid, right? Because we disperse it to one institution, not to both. So your sponsored programs, procurement offices would then have to disperse funds to those particular agencies if they are full partners. But if they're offering space for free because they really want the content, you don't have to pay them necessarily, or they might say, yeah, you can use our space. It'll cost you $150 an hour or something to utilize the space itself, because there's technology and upkeep of the technology as well. So it just varies. Because they might say, we'd love to collaborate and partner with you, but if you're working with a community-based organization where they need money as well, you do have to think about that. And Jaren, you'd like to ask a question.
Go ahead, Samuel. I'm sorry. Samuel had a follow-up, and then
Okay.
Jaren definitely will have time for you.
Okay, so Sorry if I'm asking some kind of a stupid question, but
No,
do
no,
something.
no.
So yeah, Tony mentioned something about paying the that partner institution or something like that. Does that mean that grants that I requested from you can be used to pay to my partner organization or something like that? Because some costs may happen because of the partnering, the participating organization or something like that. Can I use this grants to cover those costs?
Yes, and bringing in a partner early on can help with discussing what the costs may be in advance and help you plan with budgeting itself.
Okay,
Okay,
I see.
and
All
then
right, thank you, Tony.
sure, Jaren, you had a comment.
I did, and I laughed because it is I asked the question, may I say a comment? No, I feel like sometimes we just don't anyway, describe enough. Thank you all so much for doing this. So I'm a second year PhD student. So naturally any funding opportunities can be frightening, and it seems like anyway, it seems like your livelihood depends on getting it right, which it probably does. And I just really appreciate Tony and Nancy and everybody that helped to put this together, because yeah, for myself and lots of others, I feel like this is really really helpful. And I did want to say, as far as asking dumb questions, I always like to live my life by the mantra that the only dumb question is one that goes unasked, right? Because
Yes.
we all have them. And yeah, so getting that clarification is so helpful. Thank you, Song Yao, for asking those, but I appreciate it.
And then,
Thank you, Jaren. It's wonderful to have you with us, and I hope it's helpful ongoing.
I'll read out loud the final question that we can answer, and that was, did you mention that the F&A was part of the total 30,000, or is it separate? And it is part of the total dollar amount. In the request for applications, it does say that it's inclusive of that. So your total, so your indirect and direct, cannot go over $30,000. Okay. Well, thank you everyone for your time. I hope you found some of the information we provided helpful for you. And if you're able to attend the upcoming sessions, fantastic. We look forward to seeing you. If you're unable to attend, you are encouraged to register anyway, because those who are registered will email you when the recordings are available on YouTube. So thank you all for attending. And if you want to touch base with us afterwards, both my email and Nancy's email are available, as well as our schedulers. So thank you all.
Thank you, everyone. Take care.
And stop recording.